I first want to clarify, we're so happy that you all turned out, and we're thrilled about the announcements that you'll be hearing. I want to tell those veterans that are here with specific questions or challenges. Okay. Or shoot. Hi. They can't hear me back there. Okay, is there one of the white mic? Is this one better? No, use this one. Can they hear me now? Okay. Again, I want to thank you for being here this afternoon. For you veterans, the day before Veterans Day, thank you for your service. Thank you for your service both in uniform and as you serve your communities today. And I just want to convey that this will be a press conference, but if there are those of you that have individual questions, issues after, I have staff all the way around the room that will help you if you stay behind, and will address each of your concerns. So again, good afternoon, and thank you, and welcome to the El Paso VA healthcare system, and thank you all for being here with us today. I am Gail Graham. I serve as the acting director for the El Paso VA. I've been here since June of this year, and during that time, I've developed a sincere affection for the community, the veterans, and the employees who serve them. In fact, nearly 50% of our employees are veterans themselves. So throughout the month of November, ceremonies and observances are being held across the nation. All of these ceremonies trace their origins to the 11th hour of the 11th day of the 11th month of the year 1918, when World War I ended. The brave men and women living and died who have served in our military deserve the tribute. Moreover, our veterans deserve the best health care that a grateful nation has to offer. In keeping with our commitment to timely, quality care, a Saturday, November 14th, VA medical centers across the country will participate in the first ever Access Stand Down. A team of clinical leaders, administrators, and volunteers will be on site at every VA medical center in the country to reach out to veterans waiting for urgent care and to make sure that they are meeting their health care goals and needs. This Saturday, the El Paso VA will be open from 9 to 1. We will have 3 primary care teams here, mental health teams, and providers available. Other staff will be available to answer questions about the CHOICE program and community care referrals. The community-based outpatient clinics will not be participating during this initial stand down. On the eve of Veterans Day, I'm pleased to announce that the El Paso community is accomplishing one of the key areas of improvement outlined by the VA Secretary McDonald in the My VA initiative launched in September 2014, that of enhancing strategic partnerships. In conjunction with our partners standing with us today, we are working to ensure that our community is delivering excellent care to veterans. And one example is the 8 residency positions that we were awarded last week in conjunction with Texas Tech University Healthcare Center, Paul L. Foster School of Medicine, under the VA Access, Choice, and Accountability Act of 2014. Without the support of our congressional representatives and the support of Texas Tech, represented here today by Dr. Lang, this would not have been possible. We are thrilled about this advancement and the promises it holds for the future of the El Paso VA. Another aspect of the My VA initiative that is underway is the realignment of our organization. El Paso VA is now aligned under the Texas Medical Centers. You'll hear today from Acting Network Director Dr. Wendell Jones, and what we like to call the Texas Vision, or the Texas Network. Dr. Wendell Jones, following Dr. Jones, Congressman O'Rourke will talk more about why we're here today, and followed by Dr. Richard Lang from Texas Tech Healthcare Center. So I, again, thank you for being here, and we'll continue next remarks.
Thank you, Gail. Good afternoon, everyone. As Gail said, I'm Dr. Wendell Jones. I'm the Acting Network Director for Vision 17 and also the Chief Medical Officer. Now, what's a VISN? I know some of you might not know what that is. That's akin to a region in VA. As of 6 weeks ago, we were at 21, but at the end of next fiscal year, we'll be down to 17. Secretary McDonald felt that it was better to realign our VISNs among the state lines, and we're doing that. So El Paso was a part of VISN 18 and now is part of Vision 17. So for the community, thank you for being here with us today. I have to say that our mission and our parameters are somewhat limited at times by law. So we're very...
We can't hear back here. Only have one ear.
Okay.
Good ear.
Okay. We are very much needing to partner with the community to deliver services for our veterans, and we welcome that opportunity. Congressman O'Rourke, thank you for your partnership here with us in El Paso. There's certainly no shortage of patriotism around here. We appreciate you working with us to improve veteran care. Gail, thank you very much for your outstanding leadership as the acting director here. I know you've had many... You have many dedicated staff here. We're very happy to them, too. They come here and work every day, and we really know that they love working with our veterans. We appreciate their service. I'm glad that the people here in El Paso are committed, like I am, to health care. I'm a physician. I'm constantly amazed at what the body can do, what the mind can do. The systems at work in all of our bodies are much more complex than anything that we can build ourselves. We learn more every day about these intricate systems through the research we do in VA and through our medical schools. The more we learn, the more we improve health care, we improve services. Our commitment to constant learning and constant improvement is the key to making VA better each and every day. I'm committed to doing that, and we'll continue to do that each and every day. Thank you.
Dr. Jones, thank you for coming down to El Paso and making the trip to be here. We're excited to be part of your network, to be formally part of Texas. Sometimes El Paso doesn't fully feel appreciated by Texas, but we do now that we're part of your team. Gail, I've just got to echo the comments about Gail. She's been here a little over 5 months and has already provided absolutely transformational leadership that was badly needed at the VA, and has been the support for these incredible doctors and nurses and frontline staff and administrators who work day in, day out at the VA. She said more than half of them are themselves veterans who wake up and come to work each day with one thought and one thought only, and that is, how do we better serve the veterans who put their lives on the line, who've so ably served their country, and who have earned and we are obligated to provide the quality of care that for far too long here in El Paso and even nationally they've been unable to receive. Now that is in spite of the best efforts of some of the best providers, and we see some of them around the room today. It's simply been an issue of resources, an issue of demand exceeding capacity, and an issue of a business model that may have worked in generations past but simply does not work today, and Gail is already leading that transformation here in El Paso. I want to, way to go, Gail. In a minute, I'll introduce these amazing men and women who are standing behind me, who are part of the exciting announcement that we are making today. But first, let me do this. Tomorrow is Veterans Day. We would have had the press conference tomorrow, but I believe the VA will be closed tomorrow in observation of Veterans Day. We'll be out with Jimmy Melver in Northeast throwing candy to the kids in the parade, thanking veterans formally. And so let me thank you from this lectern today for your service, for what you do. But let me also say that, listen, you who are here, the veterans in this community, many of you yourselves, leaders both in uniform and then tireless advocates out of uniform for your fellow veterans, are probably sick and tired of hearing lip service from politicians and elected leaders such as myself about our gratitude for your service, our thanks for what you've done for this country, and tipping our hat to you on Veterans Day. Something more is needed, and that's why we're here to talk about change at the VA in El Paso that is connected to change at the VA nationally. Let me provide a little context. When I was first running for this office in 2011 and 2012, I ended up knocking on over 16,000 doors, and it was only by going door to door that I really understood the number of veterans who live in this community and the quality of service that they had access to, and the very problems of getting access to service in the first place. I'll never forget, it was January of 2012. I was on the east side. I knocked on a door of a veteran who answered the door, and when I said, I'm running for office, here's what I'd like to do for El Paso, you tell me what you'd like me to do for you, he said, I'd like you to help me get an appointment at the VA. I just got off the phone, remember this is January, I just got off the phone to try to schedule a mental health care appointment, and they told me that all appointments for 2012 have been filled and to call back next year. Surely this gentleman is pulling my leg or exaggerating to make a point. And yet, house after house, door after door, veteran after veteran, this kind of anecdote was repeated. And I recognize that the plural of anecdote is not data. So that when we got into office, we provided this community with the results of a scientific survey with a margin of error under 4% that asked veterans directly what their experience has been like at the VA. And we found for primary care wait times, veterans were waiting over 80 days just to see a doctor on average. We found that for mental health care wait times, they were waiting over 70 days just to see a mental health care provider. And then here was the shocker. This is what really grabbed our attention and made this issue so critical for us. Those men and women who answered the door and told me they couldn't get an appointment were exactly right. More than a third of veterans who responded to our survey said that they could not get a mental health care appointment in 14 days or 30 days or 60 days or a year or next year. They just could not get in at all. And it's not too big a leap to make to connect care delayed to care denied to some of the tragic outcomes that we see for veterans in this community and countrywide. 22 veterans a day in this country take their own lives. And I have met with too many mothers, too many wives and spouses who have survived a service member or veteran suicide in this community. That's how desperate and critical it is to get this issue right. So it's one thing to observe the problem, and we certainly have had a problem in El Paso. It's quite a different thing to connect that to a solution and then begin to implement it. And that's why we're here today. When you take a step back from El Paso and you look at the national picture, it's not a whole lot better. There are 41,000 positions funded and authorized in the VA nationally that today go unfilled. 41,000 psychiatrists, psychologists, doctors, nurses, frontline providers who we cannot hire, who are not there to meet the demand from veterans throughout the country. We have a really hard time building hospitals at the VA. We're $1.1 billion over budget at a VA hospital in Denver. We're $300 million over in Las Vegas, over $200 million in Orlando, and the same in New Orleans. We're not very good at the VA at building full-scale hospitals, at hiring the providers that we need. So how do we fix this problem of access in El Paso? And how does it serve as the model to fix the VA nationally? Let me give you an overview of what we, my office, Gail, the team behind me, the veterans in this room, this community put together to fix the VA. Rests on three simple points. The first, the VA should focus on its core competencies, on those conditions that are uniquely connected to service and combat. I'm talking about post-traumatic stress disorder, traumatic brain injury, military sexual trauma, traumatic amputations, those signature wounds, disabilities, and conditions that are uniquely connected to service and combat that the general population may not see in anything close to the numbers that the veteran and service member population sees. So VA, you focus on that, you do that very well. No veteran has to wait. You're seen by doctors and providers who only see other veterans and service members, so they know what to ask, they know what to look for, they know how to treat, and they know how to ensure better outcomes. Then, point number two, if you have a condition comparable to the general population, you need to get your teeth fixed, you have diabetes, you have problems with your feet, there's a better than even chance that you'll be referred to a doctor in the community, a great doctor at Del Sol, or a great doctor at Providence, or a private clinician or somebody else in this community who's willing to take the VA reimbursement rate, which, by the way, they will not get rich in taking, but who's willing to serve these veterans so that we can free up capacity here in the VA and ensure that we focus on those veterans who have life-threatening conditions if not treated, if not taken care of, if not provided continuity and consistency in care. They will suffer, and some will tragically lose their lives. That's point number 2. Point number 3, for all of this to work, and this is the heavy lift, the VA will have to develop competence and ultimately excellence in the coordination of care, because there are certainly veterans who have PTSD but also get the flu or have diabetes or have conditions that may be treated best in the private sector by a community care provider. We need the VA to be the hub that connects all those appointments, whether they take place here, whether they take place in the community, whether they take place through telemedicine, to ensure that appointments are made, appointments are kept, and outcomes are tracked so that every veteran in this community gets world-class care. Those are the 3 ideas, and as much common sense as that makes to me, and hopefully to you, that represents a groundbreaking sea change, to mix my metaphors, at the VA. This is not business as usual. Before, the VA said, we will treat all veterans for all conditions all the time. And for those of you who could get in to get care, you told me you got world-class care. You were treated really well by the providers here at the VA. But again, far too many of you told me you couldn't get in at all, or if you did, you could not get your follow-up appointment. This helps to solve that issue. How are we going to do this? We're going to partner with institutions like Texas Tech. We looked at the 10 best performing VA medical centers in the country, and there are about 150 of them. The 10 best, each of them is connected and joint ventured with an academic medical institution like the Paul L. Foster School of Medicine. Inexplicably, and not to cast blame, for whatever reason, we had not done that successfully here at this VA, despite having a brand new 4-year medical school. Under Gail's leadership, with President Lang of Texas Tech, we're beginning to see changes already, where faculty at Tech are beginning to devote some of their time to the treatment and care of veterans, where we will see 8 new residencies. These are the graduate medical education positions that bring talented young doctors to a community like El Paso that's underserved. Then we help forgive some of their indebtedness, and then they choose to stay here after they have lunch at L&J, meet a beautiful young El Pasoan that they fall in love with and have kids, and end up taking care of veterans throughout their career. That's going to happen in El Paso. Gail is pleased to tell us, and I'm happy to share with you, that she's building 2 new outpatient clinics in the community. In addition to retaining the clinic where we are sitting today, there will be a new clinic on the west side and a new clinic in south central El Paso, and that will complement the existing clinic in East El Paso. El Paso, Gail, the Paso del Norte Health Foundation, the area hospitals are going to break new ground on health information exchange. This is how we securely but effectively share sensitive patient medical information so that those veterans seen outside of the VA will ensure that their records follow them. When they're treated outside of the VA, that treatment record goes back to the VA, stays with their record, stays with them. That means we don't drop medications. It means we don't drop prescriptions. It means we don't drop the regimens of care that have been prescribed to these veterans, and everyone with that care has better outcomes as a result. All the significant providers in this community are either taking what is known as Choice, which is a program under the VA to refer care out into the community, or like Dr. Spear at Mentis, are taking other VA-funded programs to take care of veterans in this community. So despite the fact that it is a huge pain in the neck to subscribe to these programs, do all the paperwork, make sure that you follow the letter of the law, despite the fact that you're paid at VA reimbursement rates, which are very low, this medical community in this town is stepping up because they want to take care of the veterans in El Paso. And lastly, in terms of the details of this plan, the El Paso VA, through the leadership of this VISN and from the Secretary, is going to break new ground when it comes to the coordination of care. So they're already hiring care navigators who are going to work with each and every veteran to track their care in the VA, outside of the VA, their prescriptions, their outcomes, the follow-up appointments, everything. Those things that in all instances are not being done today, if we successfully implement this model, especially with these care coordinators, we're going to see implemented in the future. And before I introduce Dr. Lang, and in his time as president of Texas Tech Medical Center here in El Paso, has really been one of the main drivers of making this possible, I want to introduce some of the other partners who are standing behind me. You met Gail Graham if you didn't know her before. You met Dr. Jones. To my right, to your left, is Angie Rosales, who works with Emma Schwartz at the Medical Center of the Americas. When I had Secretary McDonald, the Secretary of the VA in town, and I was trying to sell him on the capacity at the MCA, on the abilities of tech to complement what they're doing, Angie and Emma gave us a guided tour of the MCA campus and said, we'll make land available to you, we'll make building space available to you, we just want to see the VA be successful. We have David Buckmuller, who's standing just behind me, who, if I'm being honest, and it's hard because I'm a politician, but if I'm being honest, he really was the brains and the muscle behind the plan that I just described to you. We hired him in our office after a very storied career running and transforming hospitals all over this country, including in El Paso, to tell us how to get this right. And he interviewed every significant medical provider, met with the veteran service organizations, and brought us back his best ideas. And he, in many ways, is the true author of this plan. Sally Deitch has an official title, but she's really the queen of all things Providence in El Paso. And Sally was with us from the absolute very beginning and really functionally said, here's a blank check. What do you need us to do? We're going to step up to help veterans, whatever it takes. Jacob Cintrone, her counterpart at HCA, who's also just behind me, was much the same way. Actually, even before we began on this initiative, he came to us unsolicited with Bertha Gallardo and said, I know we have capacity issues at the VA. We will dedicate a wing of one of our hospitals just to the service of veterans if that's what it takes. Tell us if that's going to be helpful to you. So thank you to you all for what you've done. Colonel Shmersky, who is directly behind me, is going to be absolutely critical going forward because he is the commander at William Beaumont Army Medical Center, which today is conjoined with this facility. Tomorrow, in 2018, will be 9 miles to the east in a $1 billion state-of-the-art facility where when I talk about some of those signature wounds and disabilities like traumatic amputation or significant rehabilitational need, we're going to make sure those veterans go to Colonel Shmersky's shop, get taken care of, put back together, and on the path through rehabilitation to a normal and productive life. We have Bill Sparks. Bill Sparks, who I knew back when I was on city council long ago, who always made sure that veterans issues were at the forefront, was one of the key veterans who helped us vet this issue. Melinda Russell, who is just behind me to the left, an Iraq war veteran who came back and because of concerns she had about access to mental health, started her own rehabilitation center at her house in East El Paso and has been a tireless advocate for veterans. Roy Aldridge, also to my left, to your right, Korea War veteran who enlisted and lied about his age at the age of 16, goes to Korea to fight, is sent back home, waits till he's 18, re-enlists, serves, is captured, is held as a prisoner of war, comes back to this community, founds a veterans advocacy to help other veterans such as himself, and truly exemplifies service because in uniform, out of uniform, he's doing everything he can for his fellow service member and veteran. Sean Robinson, who was in on some of the very early meetings at Texas Tech when we were coming up with best ideas, throwing things against the wall to see what would work for veterans, what made sense with existing capacity within the medical community, was incredibly helpful and was not shy about giving his opinion and telling us where he thought we could do a better job and making sure that we knew that we would be held accountable for the success or failure of what we're talking about today. And last, but certainly not least, I mentioned him earlier, Dr. Spear, who happens to be a terrific friend to me and to this community, Coronado High grad, UT grad, amazing medical career, decided to come back to El Paso to open what I think is the only significant neurological rehabilitation center in this part of the world, Mentis, where he serves as the medical director. He helped us to design some of what you see in this plan, especially as it pertains to traumatic brain injury and the kinds of conditions that back in Korea, in Vietnam, in World War II, would have left soldiers on the battlefield. Today they're returning back home, but they need unique, specialized care. And Dr. Spear and Mentis and his team have stepped up to provide that care to veterans and also to advise us on how we do a better job in shop. So with that description of what it is that we're proposing, what we're actually going to be able to implement, thanks to all these partners behind me and in the room, I'm going to turn the microphone over to President Rick Ling of Texas Tech, who has been an absolute amazing ally here in El Paso, traveling to Washington, D.C. to meet with Secretary McDonald to make El Paso's case and to selflessly give of Texas Tech's resources so that the El Paso veteran will get ahead. With that, President Ling.
You never want to follow Congressman O'Rourke when you're speaking. And I'm going to have a hard time explaining to my wife why eating an L&J was fine, but you now want me to marry an El Pasoan. She's not going to understand that. I stand in front of you not representing Texas Tech, but representing the entire medical community that you see behind you. This wouldn't have happened without Beto O'Rourke first identifying the problem, quantifying it, and making sure that it was an important issue, not only here in the community because you knew it was, but making sure it was important in Washington. And then assembling the entire medical community. And there is no exaggeration. We sat together in a room together. There wasn't a leader, except I said David Bookmiller was actually the leader. But to say, what are the needs of the community, the veteran community here, and how can we meet them collectively? It's not just about a single university or a single hospital or a single health entity, but what are the needs and what do we need to do to meet those needs? And the plan that Congressman O'Rourke rolled out to you was a plan that was developed by the committee, honed by the committee, and presented before Secretary McDonald in Washington. I had the privilege of doing that on behalf of the committee, but not for Texas Tech, for the entire community. And we are entirely behind this plan. And at the end, we could see that we're presenting this plan. It's countercultural. It's very different. And by the way, it wouldn't happen without Gail Graham's leadership saying, I know this is out of the ordinary, but we think it will work and we think it's necessary. And my commitment or my challenge to the Secretary was that you give me a cohort of veterans and let us do what I'm going to call the El Paso plan. Not the Texas Tech plan, the El Paso plan. And at the end of a couple years, you see whether it's less expensive, you see whether their wait time is decreased, you see whether their health care is increased or not. Just give me some time and let us show you what we can do as an El Paso community. And I think what you're going to see is what was proposed isn't going to be unique to our community. I think it's going to be rolled out across the United States. What can we bring to the table? Well, obviously, our collaboration with Gail allowed us to bring new residents to the VA. And by the way, we know that if you train here, you're more likely to stay here and practice. That is, you get a vision for the mission. You understand what it's like to work with veterans. And if you've not had the opportunity like myself, my dad was a veteran of 22 years of the U.S. Air Force. If you've not had the opportunity, you understand how important it is and what a rich resource they are, and you want to care for them. And so training those individuals allows them to stay here. By having a medical center where we recruit faculty, we can do joint recruitments. And that's very common across the United States. It was common in Dallas when I was there working at the VA. It's common in Maryland when I was there, and it was certainly common in San Antonio as well. So those resources we both bring to the table. The ability to have a health information exchange across the entire community, absolutely essential. And the opportunity for the entire community to meet the non-core competency needs of the entire community, the veteran community, is essential as well. So I'm pleased that we're able to participate We're only one of the participants. You see everybody standing behind me. It couldn't have happened without the leadership of David, without Congressman O'Rourke, and without Gail, but it certainly wouldn't happen without the collaboration of everybody behind me. We're committed to you. We're committed to working on the problems that the congressman identified, to making health care more accessible, and to providing quality health care as well. So thank you for allowing us to be a partner in that.
We're now going to open the floor to questions. Do you want to step forward? Yes.
So I understand, so you say that what you're implementing it's modeled off of VA hospitals that are already successful. So I wonder, is it mimicking what other hospitals have already done, or is there, I couldn't quite catch what was different or unique about the other hospitals?
Okay, I think there's a couple of things, and I'll let Congressman O'Rourke expand on it too. Certainly that being highly affiliated or being able to recruit staff physicians here that we can offer them academic appointments is a very big deal to recruit individuals. So that part of it, that was exemplified by some of those leading VAs. Some of the other things, focusing on core competencies, really focusing on care navigation, care coordination. As was indicated, about a third of our care right now is done in the community, but that ability to coordinate that care well is frequently challenging. So including care navigators, case managers, and then augmenting that with the implementation of a health information exchange here in El Paso. And it was one of the things that was near and dear to my heart coming here in Washington. The health information exchange engagement with the Office of the National Coordinator is my project there. So we were fortunate last week to have Dr. Margaret Donahue here to meet with the leaders in El Paso at a healthcare summit to talk about what we've learned in other communities, how we can expedite the implementation of health information exchange here. We already have almost 1,000 veterans signed up to participate in the exchange, and we've just mailed letters to 18,000 additional veterans asking for their permission to exchange data, VA data to the private sector and private sector data to the VA, so that that care coordination is smoother, that there's really less chances to drop any of that communication.
So sorry, to make my question clear,
Okay.
what is different in the El Paso plan that
Yeah, go ahead. Right.
the other VA hospitals?
Okay.
So in terms of other VA hospitals or other VA systems, we took what works in other VA systems, so an affiliation with an academic medical institution, that works. But we're going to fix what is broken in El Paso and in those other institutions, which is, for example, trying to be all things and care for all needs for all veterans. There simply is not the capacity, and that's why I mentioned that 41,000 funded unfilled. And so what is an absolute game changer coming out of El Paso is to have the VA, for the first time in the history of the department, say we're going to focus on core competencies in-house, those things that are unique to combat and service. That's never happened in the VA before. And as Gail said, we're already referring out a lot of care, but we refer out stuff today that is connected to combat, stuff that's not connected to combat. So we're going to refer out more of the non-combat connected care out into the community and really hone and develop our competencies and excellences in care for combat connected issues. That's a huge change. And I'll say this as a preview. I would not be surprised as the VA nationally tries to figure out what the next generation of care will look like if they don't base it on El Paso. Because that problem that I described in the VA of attempting to be all things to all veterans really hasn't worked in El Paso, but it's not really working anywhere else. And so if we can model this successfully, El Paso not only meets its obligations for the veterans who live in this community, but El Paso, and this is really exciting, leads nationally and shows the VA nationwide the path forward. That to me is really exciting.
Yeah, will you explain what has been implemented and where you are in all these
Okay, so the question was what has been implemented, what's been done so far to get some of these changes in place. So first of all, as I discussed a little bit, we are working with Paso del Norte and the community to really get health information exchange up and running here in El Paso. That communication of that medical information is a vital component. The El Paso VA was already on the road to hire care navigators, case managers for our most critically ill veterans, but we're looking to work with VA Central Office to possibly expand that care navigation. As Congressman O'Rourke brought up, we are proceeding. We had what in the VA is known as a out-of-cycle approval of 2 new locations in El Paso. So the west side will be about a 13,000 square foot facility. It will offer mental health care and primary care, hopefully making it more convenient for many veterans, because we know with the resounding interest in our Veterans Transportation Service and the DAV transportation services, it's still not enough. So we're working in that area. The grant that we applied for that we just received last week under the Veterans Choice Act to add 8 new residency slots to our relationship with Texas Tech, and that's in addition to the 5 residents that we have currently with Texas Tech and the 9 medical residents we have with William Beaumont. So expanding that care. For access to care, we've added telehealth providers, so we currently have 2 mental health psychiatrists that provide mental health services to our veterans, but through telehealth intervention. We are focused and moving ahead with mental health hires in every area. As many of you know, we have a new director of mental health, Mr. Brian Olden. Mr. Olden is a Vietnam veteran and brings that perspective to the table. We also, over the last few months, have brought in a new director of primary care, and Dr. Toth, and he's done remarkable things there. I think, too, I met with the other directors in the new Texas visit a few weeks ago, and certainly they're reaching out to us, too, of where can we fill gaps that, frankly, are a gap both in El Paso and in the VA. So can we do more with teledermatology and some of those things? So those are just a few of the things that we're actively doing. And I have to say, on a personal note, this community has been so supportive that it's been amazing. Not every community has providers responding to the request to become choice providers or to provide non-VA care at either Medicare rates or less than Medicare rates. So this community's involvement, engagement, compassion for veterans is absolutely what sets El Paso apart.
Will this plan also include incentives to bring more doctors here? And I guess what are those incentives?
Okay, the question was about, will the plan include incentives to bring more doctors here? It certainly does include actually utilizing incentives we already have. So we have mechanisms to do loan repayment for academic indebtedness for physicians, nurse practitioners, nurses, and others. So we're really using those to their fullest extent. We certainly try to be competitive with salaries in the community, but as Commander Smirsky pointed out this morning, many times for VA or for DOD, we can't compete on the salary. I mean, we will try to be as competitive as we can, but we will reach a point. So adding the federal benefits for a physician not having to pay malpractice, for that loan indebtedness repayment, to make a competitive salary, and for the benefit of treating veterans, which is a mission of love and commitment. So, but certainly we're exercising all the options that are available to us at their maximum.
Sounds like a great idea. Lots of work to do. What's the most challenging part of this, do you think?
So the question is, what's the most challenging part? And maybe each of us have a different perspective. So I think, honestly, the most challenging part, and we are working closely with the Chamber, with other healthcare providers, with the Healthcare Council in El Paso, the most challenging is really recruiting providers to El Paso, selling them, their families, on what a great place this is to live, and really making a statement. So I need the whole community to embrace these individuals as they consider El Paso as a place to work and live.
Yeah.
but I think we probably all have a different perspective.
I think one thing to the last question, to bring more providers in, I joined the VA in Miami, and one of the incentives that I had was teaching residents and students. And a lot of us docs that are growing up in age, we like treating patients, but we also like teaching new doctors as they come in and try to share some of our experiences with them. So I think that the fact that we're bringing new residents in will help with recruiting. So the recruiting, I agree with you that recruiting in certain areas is harder than others. And this might be one of the areas that might be a little bit harder to recruit than, say, in New York or Washington, D.C. But the fact that we're bringing in new residents, we can bring in younger docs to train those residents that come in. So I think that will help.
Any other questions from the press?
How many vacancies do you currently have? I guess within physicians or mental health providers?
Okay, currently for mental health, we have about 18 total vacancies. And we, this is, as I indicated, actively recruiting all the time. We're looking at, we do have some applicants that would like to also do telemedicine, so we're looking at the possibility of expanding telemedicine, but we're actively recruiting every day. The openings are there. We have a physician recruiter that services El Paso and other VA hospitals in this area, so we're advertising in journals and, just so we're trying to hit every door that we possibly can. But I just want to comment too that, as many of you know, Dr. Vivek Singh died recently, and he was a great champion for us. And as Dr. Lang indicated, one of the things that Dr. Singh did immediately after we met him and after he came to El Paso was he made sure that the Texas Tech psychiatrists were registered as what's called choice or non-VA providers without hesitation and immediately. So I'm certainly working with people like Dr. Singh. He also extended an offer that we're working with Texas Tech on to actually have a veteran mental health clinic at Texas Tech. So as you know, mental health recruitment is not a VA problem in Texas Tech. It's an El Paso problem. And we need to work together as a community to solve it, to make sure that any asset available is fully utilized for whomever needs those services. So, can I take this question? Yeah.
Ms. Graham, number one, I want to thank you for being here in place of the other management we had here. I think you're doing a super good job. I think you now have a good team behind you, including my friend who was before. What I'm inquiring about is the mileage test. Mileage test. That mileage test has been a pain in my neck and a lot of veterans down here, so it's never followed through with it. It's never been taken care of right, and it really gets us upset because we're alienating us with other veterans.
So I just want to emphasize one thing. As I said earlier, we have a Veterans Transportation Service, and we also have the Disabled American Veterans that run transportation, but we can't keep up with the need in El Paso. We also have a program in VA that is unique to VA, as some things are, where we reimburse veterans for what's called beneficiary travel, or the mileage from their home to the VA. So we're transitioning that to an electronic determination and reimbursement, and trying to work with veterans to work through the challenges with it. But the other component is under the Veterans Choice Act. There is a provision for those veterans that live 40 miles or have a burden in travel, and you can work with our staff to determine if you would qualify there. And in those cases, the care can be provided in the community where those veterans reside, solely by the community. So certainly working through those transportation challenges is certainly one of our goals, and we are thankful for those both in the public transportation area, the veteran service organizations, and others that are trying to help us work through that. So. And I'm gonna, but I'll get to this. So the question was, we have 18 mental health vacancies, but we have about, Mr. Olden is standing right there, we have about 116 on staff right now. We also are integrating mental health providers into primary care. For those individuals that maybe they have moderate depression that's well under control, we're really trying to manage them along within their primary care environment so we can free up availability for those with more intense needs in our mental health clinic. So that's the other thing that Mr. Olden has put into place since he came.
How soon can veterans expect to see the benefits from this plan?
So the question was, how soon can veterans expect to see the benefits from the plan? I hope that that they're seeing them today. I hope that many veterans are seeing some of the positive changes that we've made with recruitment and with expansion of care. Certainly the fact that El Paso providers came out in great response to becoming choice providers has made a huge difference in those care that we refer to the community, which is not the case in every community. So this community is to be commended for that. So they should be seeing it in the changes that we've made there as well. As I said, we have about 1,000 veterans already signed up for health information exchange, and if they've traveled to places that are already exchanging data, our providers can see that data today. For those additional providers, we're working, as I said, with Paso del Norte, so within what is projected to be the spring of 2016, we should be connecting to the Texas Health Information Exchange, and so they should be able to see that their information is flowing back and forth between providers. We will work with Texas Tech to begin the recruitment for the providers. We're already working with Texas Tech to get more of our providers academic appointments at Texas Tech. So I'm hoping that they've already seen some changes and that they'll notice changes for the better every single day.
Let me add one thing to that if I could give. You know, Gail mentioned the number of mental health care providers. That's to date the high water mark. We've never had that many mental health care providers at the VA. There's still a lot of vacancies. Gail and the VISN have actually recruited me in our office to make phone calls, to kind of recruitment phone calls to try to seal the deal on some of these. So that's a positive step and a difference. Anecdotally in our office, we're hearing very positive things from veterans on responsiveness. If you've been to one of our town halls, you know that one of the hallmarks and best traits of the El Paso veteran is that he or she does not hold back in their complaints and concerns about the VA. We're hearing far more positive stories, frankly, than we have ever heard. But the 8 new residencies, the fact that Texas Tech is hiring providers and making them available to the VA, that's all new. And the fact that all of these community providers are standing here today with us, they're all accepting VA payment for care to see veterans. That's an absolute first. So I want to be clear, there is absolutely no mission accomplished banner behind me. We're not satisfied, the job is not done, but this picture that you see right here is an absolute first. In the 3 years that I've been here, the VA and the community to some degree, if you want to say my office, have been at odds. We've been saying we need better care, we need transformation in care, and the VA in large part has said, we've got this covered. To have this leadership today that says, I want tech, I want Tenet, I want HCA, I want Mentis, I want all these providers, I want new medical residencies, I want telemedicine, that is an absolute breakthrough. And so the picture today represents the veterans, the providers, the organizations in the VA, and the political leadership necessary to fulfill this promise that we see in this plan. That's what I think is really remarkable. And with the clinics, the residencies, some of the other things that are coming online that Gail and Dr. Lang mentioned, there are actual palpable developments, things that are actually happening right now to show that it's more than just a plan, it's actually being implemented.
Once we have time for one last question and answer.
When will the residencies begin?
So it was just announced this past week. The residency interview process is unfortunately going on right now. So we'll start interviewing them from July till December of next year. And so the first residents will probably be here in July of 2017. If we can get him here earlier, we will.
I just want to thank all of you for taking the time to come. I want to thank